What's inspiring is the terrain, how beautiful it is. Its remoteness belies its beauty. She's a unique individual that is able to bridge or has bridged the gap between the academic medicine that we all try to practice in our urban areas into a very remote, rural, underserved area.
A lot of us in metropolitan areas wouldn't dream of hopping in the car and driving over to the patient's house when they call us to sit there with them and try to figure out what's best to do. And she does that on a daily basis.
Just incredibly admirable. And there have been a couple of Plessner Award winners from this area. It's an extraordinary medical community, but even within that extraordinary medical community, people like Dr. Smith are special.
She must have a photographic memory because she can tell me everything there is to know about each patient, why we're treating them the way we are, what their belief system is.
I have known Dr. Smith for many years, since I was a young girl. So I don't know exactly the year that she came to Hoopa. I just recall her always being a part of our community.
Well, I'm a member of the Shinnecock tribe in New York, and I'm here in Hoopa because I married a Hoopa, who's also a physician on staff that you may get to meet later on. I grew up in a large Indian extended family system. Actually started college thinking that I was going to be a journalist, then went on to get my high school teaching license, and a number of things happened that kind of was pushing me in a direction toward medicine. Didn't know if I was smart enough, didn't know if I was disciplined enough, but thought this is a different way to help. And I knew that my life was going to be working in Indian country.
Hoopa is a community. It's about an hour and a half away from Eureka. There's no hospital facilities up there. I practiced medicine up there briefly, and you're really on your own a lot, or do a lot of, call up the ophthalmologist and describe what you're seeing and get some idea how to handle things. So it takes a lot of courage and gumption to practice medicine in that setting, and she stuck with it. There are a lot of other doctors that come and gone through that community and didn't stick around.
I think we're really fortunate in having a lot of medical clinics, Indian medical clinics in the state of California. There aren't too many clinics that can claim true practitioners, husband and wife team. And we've had them since '96, so we don't have to worry about retention because they're very happy here and making provision. Emmett is from here. Eva is from New York State, Long Island, Maine, more or less.
We're very happy with our accomplishments and with our life and integrating with the culture in the community. And we were very glad that our daughters got to grow up here.
I'm an Indian woman that dances. I'm an Indian woman that was raised as a little girl to dance. And so my daughters have been raised both ways, and they're very involved with traditional life here, as they're actually enrolled in the Hoopa tribe, but they've got a lot of Shinnecock in them. The first time I heard the heartbeat with a stethoscope, I cried in med school because that is the sound of a drum. And so when you're dancing, at least in my tribe's way, your heart is in sync with the drum beat. And that's spiritual and empowering and humbling.
She does it all. She's treating diabetes, hypertension, heart disease, chronic lung disease, substance abuse, whatever happens to come in the door, and you never know what that is.
The resources for Indian communities are so lacking that we kind of understood that because we wanted to work in Indian health. So, you know, that means long work days, that means seeing a lot of patients, that means dealing with a lot of social issues along with the medicine.
There's days where she sees as much as over 2 to 3 providers, and it's not uncommon. She provides services to people, 60 miles away, to Orleans, probably even past Orleans, Happy Camp, all the way to Salyer. I mean, she provides services for a large area.
Trauma comes in, people who've been shot, people who have been injured in accidents, people who are having a heart attack, and all of that is dealt with by the family doctors there, and, one of which is Dr. Smith.
We're all technically trained in our fields, but there's a smaller percentage that actually have the artistry, that gift, that special something. And Dr. Eva is one of those who has that.
So every person that I'm in contact with, including in my work setting, are valuable human beings that deserve love and attention, and sometimes life doesn't always give you all the love and attention that maybe you need or want, and if I can give a couple of kind words of encouragement that help somebody go a little bit further, that's a good thing. In addition to, oh, by the way, let's see how we can take care of this, this, and this, or let me help you learn about this so you can better take care of yourself. When I was able to get involved with addiction medicine, I was so excited because a lot of the treatment for addiction medicine involves spirituality. And it was like, finally, there's a section of medicine that really allows me to bring all that together.
For her to substance abuse is more of a caring approach, I think, than most people, where they just think, oh, it's somebody with a drinking problem, but more, where there's other things involved other than just the drinking problem. There's deeper issues.
The bulk of my experiences in the past have been predominantly alcohol-focused, some marijuana, a little bit of prescribed opioids. When I moved here, it was a whole nother exposure to methamphetamines that had been in this region, not just the tribe, but in the region for a long time. And now struggling with prescribed opioids, as is the whole country. This epidemic of prescribed opioids, and then kids start it, they can't find it, can't afford it, so they're into heroin. So it's some real challenges, real challenges. But when you're in the home, you get the family context, you get the social context, and you realize, oh, there's a whole lot more going on, which may influence health decision making. If it's a grandma that's taking care of a whole bunch of kids, grandkids, great-grandkids, I may be frustrated that, why is your blood sugar so out of whack? Well, when I'm there and I begin to understand her stressors in a different way, see how many different ways people are pulling at her, that her self-care isn't always her number one priority.
We answered the door, a nurse and myself, and she was carrying her infant baby daughter who had stopped breathing on and off and was not responding. And so Dr. Eva, I think, was in a meeting at the time, and we urgently paged her. She came right over. We were both in the room. She was there to treat the infant, and also we were working with the mother's emotionality level because this particular mother, I believe, had already lost a child once before. And so just that coming together in that kind of a crisis emergency situation, and the way that Dr. Eva could both respond to the infant and the mother at the same time, was really rewarding.
She got some kind of award for valor back in Arizona at the Apache Reservation, where she was in the line of fire. Basically, people had guns, and she was in the middle of it, and brought the patient out alive, which was a good thing.
I've been real honored to be involved with a lot of family systems doing hospice work. There's no hospice here.
She always is very brave. I've worked in rural hospitals most of my career, and that's 38 years. And she is willing to talk to her patients and talk them through that type of thing. And I very rarely see that with a doctor. I always see it left to a chaplain or to some of the nursing staff or a social worker to break the bad news, and she doesn't do that. She does that herself.
There are times that you have to, tell stories, work with families and individuals to say, this is your diagnosis, and we're gonna help you. And I'm always saying, I can't change what's going to happen, but I promise you I'll be there. I'll be with you through it. I'll be with your family through that.
She'll sit with the people, and if they're dying, she's right there for them.
The community is really, counted on her in a lot of different ways, and she certainly has been there and, fulfilled that role and actually gone above and beyond so many times.
My dad passed away last week, and 2 weeks ago. His funeral was last week, and even though she wasn't my primary care provider, she really extended herself to try to do whatever she could to help me through it. She took time out to find out how my family was doing, and that's when she shines the most, is that particular phase in life, and in my opinion. And I didn't realize the importance of having somebody that really was so invested.
Sitting there and holding somebody's hand through a hard time and not worrying about what time it is and if it's past 5 o'clock, because she stays here until late in the evening, and then she'll go make house calls on into the night.
Right now she's treating my husband for beginning stage Alzheimer's, and he's not even 60. And I think if I didn't have her on our team and on my side, I don't know if I could make it on a daily basis.
I think there's a lot of docs out there that really care, that love the work they do, and so for future generations coming through, medicine is a really good life if you like people, or at least the kind of work that I do. I love people. I'm not somebody that would make it in a research lab. I really like the small family environment, so I'm not somebody that I think would necessarily